Hello, my name is Adolfo Ascencio, and today I'll be doing my presentation on hydrocortisone cream. So let's begin with a brief introduction. Hydrocortisone cream is available under various brand names, cortisone being the most common over-the-counter one. There are both generic and brand name versions available of this. It all depends honestly on formulation, strength, that the brands go by. It's just been around for so many times. A lot of manufacturers have dipped their foot into it. The goal of the therapy depends on what you are treating, but in general, the goal is to relieve any type of symptoms present specifically topically for skin conditions. So let's go over a little bit of hydrocortisone's background. What is hydrocortisone? Hydrocortisone is a corticosteroid hormone that is naturally produced by the adrenal glands in the human body. In the context of hydrocortisone cream, it is a synthetic form of this hormone that is used topically for its anti-inflammatory and immunosuppressive properties. Here are some key points about hydrocortisone cream. For the discovery and development, it was first synthesized in the early 1930s. It was recognized to have anti-inflammatory properties. And then also, it was aiming to provide a localized treatment for skin conditions, particularly. There are multiple strengths of hydrocortisone cream available, over the counter being strongest available, 1%, and then usually 2% or higher is the prescription grade strength. So to go into the pharmacokinetics, first to explain what pharmacokinetics is, it refers to the process of a drug that undergoes in the body, including the absorption, distribution, metabolism, and elimination. When it comes to topical hydrocortisone cream, the pharmacokinetics are somewhat different than the orally administered version of it, because it is applied directly to the skin and absorbed. Here are some key aspects of it. So for the absorption, hydrocortisone is absorbed through the skin transdermally, after it's been applied topically. The extent of absorption depends on factors such as concentration of hydrocortisone in the cream, the duration of contact with the skin, and the integrity of the skin barrier. For distribution, once it's absorbed, hydrocortisone may enter the systemic circulation, but in the extent of systemic absorption is generally much lower compared to oral or injectable forms of this corticosteroid. Um, Hydrocortisone has a lower propensity for systemic distribution when applied topically, particularly at lower concentrations. For its metabolism, it primarily occurs in the liver. However, when applied topically, systemic metabolism is less significant compared to oral administration. Um, the local metabolism of the skin may also play a role of the inactivation of hydrocortisone. For elimination, elimination after topical application usually occurs through various routes, usually through excretion in urine, but to a very, very small extent, just because only a small is entering systemically. For mechanisms of action, um, or any topical corticosteroid usually involves a interaction with cells and its biochemical process of the skin. Here's a detailed breakdown of the mechanism for hydrocortisone. For its anti-inflammatory effects, hydrocortisone, um, again, is a synthetic form of cortisol, which is a natural hormone that's produced in the adrenal glands. It binds to the intracellular glucocorticoid receptors into the target cells. For its receptor binding, after it's been applied topically, hydrocortisone then penetrates the skin, enters the cells, where it binds to those receptors into the cytoplasm. The formation of its receptor ligand complex forms a glucocorticoid receptor binding, and then the overall effect is a reduction in the production of inflammatory mediators that includes prostaglandins and leukotrienes, which are responsible for the symptoms of inflammation, such as redness, swelling, itching. Um, for its vasoconstriction properties, it does have vasoconstrictive properties, meaning that it can narrow blood vessels. This contributes to the reduction of redness and swelling associated with the inflammation itself. Some indication and dosages, topical hydrocortisone, because I'm just referring to just the cream itself. Um, its indications are for skin inflammation, so this used to treat various skin conditions. This could range from eczema, dermatitis, insect bites, psoriasis, etc. Usually is indicated to get rid of any itching, redness associated with those skin irritations or indications. For dosages, topical hydrocortisone is available in various strengths. It ranges from over the counter low strength formulations, which goes from 0.5% to 1%, or to prescription grade strength, which options are usually 2.5% and higher. The choice of the strength depends on the severity of the skin condition and the location of the body. Typically, don't want to use higher strengths on like folds or any sensitive areas such as like the groin or facial structures. It is essential to follow the instructions provided by the healthcare professional or on the product label. Hydrocortisone, like all medications, can cause adverse reactions. The likelihood and severity of these reactions can vary depend on factors such as the dose, duration of use, method of administration, individual patient characteristics. Adverse reactions can occur with both the topical cream or ointment. Here are some potential adverse reactions that are typically seen with hydrocortisone cream. We can start off with the skin atrophy. So, this is prolonged use of high strength topical corticosteroids that can lead to skin thinning, atrophy, and the development of stretch marks. We also have telangiectasia. This is long term use, may cause the dilation of superficial blood vessels, leading to the appearance of fine red lines on the skin. There's also a rebound syndrome that can happen. So, this is discontinuation of long term use. Results in a rebound flaring up of the skin condition, and in some cases, individuals can experience symptoms of withdrawal. Uh, there also can be signs or have been signs of hypo or hyperpigmentation. So this is changes in the skin color. So it can either discolor or make things appear a little bit more redder than usual. And then just any sign of allergic dermatitis. So this is usually a rash, bump, or skin that usually occurs from having some sort of allergic reaction to hydrocortisone. So monitoring parameters for hydrocortisone cream usually involve us in assessing the patient for both effectiveness of the treatment and the occurrence of potential side effects. For some key monitoring parameters, as I said, it's very minor, but obviously monitor the resolution of the symptoms itself. So monitor the targeted skin condition for any improvement. This includes a reduction in the redness, itching, swelling, or any other symptoms that may be present. Um, you also want to evaluate its clinical response. So, this is ensuring that the intended therapeutic goals are being achieved. You want to also assess the skin condition. Sometimes, because the hydrocortisone or the glucocorticosteroid can thin the skin a little bit, it can sometimes further exacerbate some of that redness if prolonged use. Patient satisfaction as well too. You want to engage with the patient and assess their satisfaction with the treatment and inquire any challenges or concerns. For safety, as I said, just monitor for any skin integrity, making sure there's no thinning or any broken barriers or any broken skin barriers. Look for any local reactions. This can be from like irritation, burning, or any like allergic dermatitis as mentioned earlier. Drug interactions. So, topical hydrocortisone creams generally tend to have a lower risk of systemic drug interactions compared to like the oral or the injectable forms of it. However, it's important to kind of list some of the potential interactions that can happen from using this topical medication. Um, Main one being other topical medications in general. So, the concurrent use of other topical medications can increase the risk of skin irritation or enhance the absorption of hydrocortisone, or sometimes even dehance it as well too. Um, So some of the recommendations we do is if you're using multiple topical medications, either try to apply them at different times of the day just to minimize the risk of interactions, or space out enough to where like the medication can be completely dried and absorbed, and then apply whichever the medication has to be applied to after. Um, there's also some skin products or any alcohol that have any astringents that can possibly interact with hydrocortisone. So you want to avoid any topical agents that may contain those ingredients. Clinical pearls for hydrocortisone cream involve practical insights and recommendations that healthcare professionals often find useful in optimizing its use and minimizing potential risks. Here are some clinical pearls for hydrocortisone cream. You want to make sure you choose the appropriate strength and duration. So you'll always want to choose the lowest effective strength for the specific condition being treated, and limit the duration of use to the shortest time necessary to control the symptom. Um, so you want to avoid any prolonged use in sensitive areas. As I mentioned earlier, this is usually like any face, genital regions, or any folds typically in the skin. So that tends to be like the armpit area where it can accumulate and kind of further exacerbate some of those symptoms. Um, you also want to minimize occlusion. So this is specifically recommended. As like tegaderms or dressings, or some people tend to want to cover the area and then put a band-aid over it, is what I typically see, or some gauze, and tape it down. That kind of creates an occlusion and can definitely increase the drug absorption, and sometimes can be a little too much and create a toxic environment for the medication on the skin. Some consultation points to hit, I feel, that are um, specifically pertaining to hydrocortisone cream. You always want to explain the specific skin condition or symptoms that warrant the use of the hydrocortisone cream. You want to make sure proper application techniques, so that's demonstrating and instructing on the correct technique, and emphasizing the importance of applying a thin, even layer to the affected area, and not just glopping a huge amount onto it and hoping that the more you put, the faster it's going to go away. Um, so then that leads to the amount to apply. As I said, start off with the thin area, apply, and then if needed more, add in very minuscule amounts. You always want to wash hands before and after. So this is just to prevent the spread of the medication to other people or animals, children of that sort. Um, you want to avoid any contact of the eye or any membranes, mucous membranes. So this is just specifically because it is being applied topically. It can be absorbed a little bit more toxicity if applied to like mucous membranes, as it'll pretty much enter mainstream. Um, so just be careful when you're applying it near the eyes, the mouth, or like any nasal cavities. You want to avoid potentially putting it on any open wounds or infections. Um, Typically don't want to use that. Medication pretty much enters systemically if it enters directly into the bloodstream like that. And then avoid the strong use of any other topical products. So that's using any other topical corticosteroid type of products. You typically want to avoid that combination. And these are my references. Thank you.